Yep. All right. Next up, there she is, Dr. Meeta Singh. Let's see here. Dr. Singh has been with us before. She is the president and CEO of Performance Sleep Practice since 2013. She spent most of her professional career with the Henry Ford Hospital in West Bloomfield, Michigan, since 2005 in various roles. She is the sleep physician for the Detroit Lions, Detroit Tigers, the Pistons, and the Red Wings since 2013, and was also a sleep consultant with the U.S. Soccer Women's National Team for the 2021 Olympics. And Dr. Singh is also the medical director for the Columbus Sleep Lab in Novi, Michigan since 2013. Today, she's going to present on sleep and MLB, Major League Baseball, cardiometabolic, and mental health implications in players and the team behind the team. Dr. Singh, take it away. I don't think we can hear, we can't hear your voice.
Can you hear me now?
Yes, we're good.
Okay, wonderful. Yeah, I was muted. Okay, so I'm going to talk about sleep in Major League Baseball. And you're right, I have presented to this audience or to different audiences or different stakeholders in Major League Baseball before. And I've usually talked about sleep and athletic performance. So I want to do something different this time. And I want to talk about, mental health, the cardiometabolic health implications for players, but especially for you guys, the team that's behind the team, because you live that life. And I just want to make sure that you guys are also aware of, what the implications are. So why do we even talk about sleep? Like, why is sleep important for athletes? I mean, athletes typically are younger, they're healthier. Even if they did sleep poorly, why would it matter? And it matters because, firstly, athletes at some point they're going to retire, but also because poor sleep is a risk factor for poor mental health in athletes, as well as that team behind the team. It's also a risk factor for injuries. It's a risk factor for cardiometabolic disease. In fact, it's a risk factor for increased mortality and all sort of diseases. And of course, we know that poor sleep impairs athletic performance, and getting more sleep improves athletic performance. But that is not what I want to discuss in the next 1 hour or so. I really want to talk about the top 3 or 4 topics. So to that end, this is how I've divided this talk. I'm going to first talk a little bit about the basic principles of sleep and circadian science, especially as it relates to athletes and to human beings. And some of you have heard this part before, but just to lay a primer as to what is going to come next. Then I'm going to talk about sleep. I'm going to talk about mental health, how it can relate to injuries, and learn about the effects of this on nutrition and metabolism before I summarize. So, we live in a society where sleep is generally ignored, or has been ignored for many, many years. But the big picture is sleep is really, it's a non-negotiable, universal biological need. Yet we live in the society that sees sleep as an unproductive use of time. And I think this audience will agree, because you think about how prevalent the use of greenies was just a few years ago. Sleep was considered completely unnecessary. And this has led to societal pressures that devalue sleep. And it's only recently that there's this importance of sleep health. So why do we sleep? We spend 1/3 of our lives sleeping. It's 1/3 of our lives in which you're lying, you're unproductive, you're not taking in nutrition, you can't procreate, and if you were in the wild, animals could get to you, so you're absolutely unprotected. So if it wasn't fulfilling some absolutely essential function, it would be a colossal wastage of time. But let's start with this question of what sleep actually is. So sleep is, we know it as behavioral quiescence. So you look like you're very peaceful and quiet, but sleep is a time in which when your brain is disengaged from the environment and it's unresponsive to the environment. And it's got very characteristic, and even though you look like you're very quiet and peaceful, your brain waves are actually pretty active, and there are different neurotransmitters being secreted. And as a result, your brain waves look different. So when we traditionally measure sleep in the sleep lab, we look at your brain waves. We look at your eye movements, because during a certain part of sleep, which is your rapid eye movement or REM sleep, your eyes are rapidly moving and your body is paralyzed. So we also look at your muscle strength. And I want you to pay attention, because I want to talk a little bit about how sleep is now measured with wearables, or if you wear a ring, and what that actually implies. Okay, so when people fall asleep, typically once you're an adult, so you fall asleep into sleep through light sleep, which is stage N1. Then you have some amount of N2, which is a little deeper sleep, and then you have your first bout of deep sleep, or N3 sleep, or delta sleep. And it's during your deep sleep that your muscle is completely relaxed, and that's where your breathing is completely reduced, your blood pressure, your heart rate is completely reduced. So this is the most restorative part of your sleep. And then your sleep lightens, and you have your first bout of dream sleep, and you might even wake up after that. And this cycle is approximately 19 minutes. And you cycle through these different stages all through the night. And most of your deep sleep occurs in the first 3 hours of your sleep, and most of your dream sleep happens in the second half of the night. And in fact, people often ask me what stage of sleep is more important. And in fact, every stage of sleep has a certain function, and different brain waves, they're responsible for different things. So the only thing you can actually do is make sure you get enough time in bed. So if you think about how we human beings spend our time, the state of being, about 2/3 of the time you're awake, and then 1/3 of your entire life you spend asleep, out of which every night 25% is spent in dream sleep. And really you want to do this well, so this part of your life, the time that you're awake, you're fully functioning. So, and some of you of course have seen this before, so there are two separate and independent processes that decide how sleepy or alert you're going to be in a 24-hour period. The first, of course, is your sleep load. So when you wake up in the morning, let's say about 7 o'clock in the morning, by the time 11 p.m. rolls around, you have 16 or 17 hours of wakefulness that have accumulated. And this is your sleep load. And when you fall asleep, you consume the sleep load, right? So this is one thing that helps you, that decides how sleepy or alert you're going to be. So the longer you're awake, the higher the sleep load is going to be. But then in addition to this, we have a clock in our brain, and that clock, when you wake up in the morning, secretes an alerting signal that opposes the sleep load, and it keeps you awake during the day. Now in the mid-afternoon, there's a slight dip in your alertness, which is, Frank will tell you, I called and said, is there any way I can speak earlier? Because I did not want to speak in the mid-afternoon when some of you might be asleep. Nothing to do with me, more to do with your circadian dip in your alertness. Anyway, so in darkness, melatonin is secreted, and this dampens this alerting signal. So the two things that decide how sleepy or alert you're going to be is the number of hours you've been awake, as well as your circadian system. So how much, how many hours you've been awake, there's a neurotransmitter in your brain that gets accumulated. It's called adenosine, and the longer you've been awake, the sleepier you'll be. But typically people ask, how much sleep do you really need? Now, you've heard different numbers, but the American Academy of Sleep Medicine says adults need 7 to 9 hours to function well. And this is a study, this was done in 1993. And this was a study in which they brought people into the sleep lab, and they kept them in this closed, environment for almost 5 weeks. And the first week, they asked them how much sleep they were getting, and they were getting 6 to 7 hours, and that's not how much time, how much sleep they got. But then for the next 4 weeks, they gave them 14 hours in bed. And in the first 1 week, people slept, 12 to 14 hours because they were playing catch up, because they'd been sleep deprived. And then at the end of those 4 weeks, the asymptote was about 8.2 hours. And so we say adults need about, 7 to 9 hours of sleep. And we know what accumulates in your brain, and that's your sleepiness neurotransmitter, adenosine. And the most commonly used drug in the world is something called caffeine. And I will take more questions later afterwards, but this is a question that I get asked quite often. And so the way that caffeine works is that caffeine goes and it attaches itself to that part in the brain where your sleepiness neurotransmitter attaches. And so it blocks the effect of that sleepiness and it keeps you alert. But the second process is your circadian process. And I want to spend some time talking about this. Now, because we live on this rotating rock and because we have alternating cycles of light and dark, all organisms, so human beings, all organisms have developed cellular clocks. So these are intrinsic biological clocks we have that keep time with circa, which is approximately 24 hours. And for us, the master clock is in our brain. This is your circadian clock. And when you wake up in the morning, light enters your eye and it's like an alertness pill. It keeps you awake. And in darkness, melatonin is secreted and it helps you fall asleep. Now that circadian clock in your brain is just a master clock. And in fact, every cell in your body and every physiological function have a circadian clock. So, this is again, a complicated slide, but this is midnight, 6 in the morning, noon, and 6 p.m. But things like your best coordination, your fastest reaction time, your greatest cardiovascular efficiency and muscle strength, they tend to peak. So for people who go to bed at 11, wake up at 7, they peak between 4 and 7 in the evening. So all those, I was listening to the previous talk, all those tests, when they're looking at movement and pitching, etc., there's actually a time, a biological time during the day, which is unique to everybody, in which peak performance tends to occur. Okay. The other thing you want to know is that your genetic clock also decides what your chronotype is. So whether you're a morning person or a night owl is a genetic predisposition that you have. And again, not talking about performance, this has major implications for Major League Baseball, and has implications for the staff members, the training staff, the strength and conditioning coaches, because this decides what time you actually fall asleep and what time you wake up. So if you're a night owl and you can't fall asleep till about, say, 2 or 3 in the morning, but you still have to be up early, you're not going to get enough sleep. If you're a morning person, because Major League, because they're evening games, you don't get to bed on time, but you're still going to wake up early because your biological clock will wake you up. So that brings us to this question is like, what is healthy sleep? So healthy sleep, like nutrition, isn't made of, there's not one definition of healthy sleep. But, it consists of these components, and these are the 6 main components. There's regularity, which is that, you go to bed and wake up at the same time, which is not what people in Major League Baseball do. So, you get a black mark right there. There is sleep satisfaction. Are you satisfied with the quality of your sleep? There's alertness. So when do you wake up in the morning and feel alert? Are you alert in quiet, dull situations and still stay awake? Sorry, I've got a tickle in my throat. Just drink some water. There's the timing of sleep. Are you sleeping in alignment to your biological clock? There's sleep efficiencies. Like, are you sleeping 85% of the time that you are in bed? Or are you laying there awake? Do you have difficulty falling asleep or staying asleep? That is also, makes a difference to whether you're getting healthy sleep or not. And of course, then there's duration of sleep, which we already talked about. So are you getting the 7 to 9 hours that are recommended? And I will tell you, having worked with multiple leagues, and definitely with Major League Baseball, on each and every aspect, when you're thinking about what healthy sleep is, this being in the sport itself, not just for athletes, but for the training, the team that's behind that team, attaining good, healthy sleep in each of these parameters becomes a difficulty. So why does it matter? So, we spend a third of our lives sleeping, and overall, we don't really have this broad concept of why we are doing that. We know what happens when you get less sleep, and of course that has really important implications. But perhaps one of the things that happens when you're sleeping is that while you're asleep, and this was, it was discovered a few years ago, that while you're awake, toxins are accumulating in your brain. It's while you're asleep that blood rushes through your brain and it power washes it of all these toxins. And so there's a thought that if you don't get enough sleep, it's associated at some point with developing dementia, which is accumulation of toxins in your brain. There's also studies that show that while we are awake, DNA damage occurs. And this is a study that just came out, and what it showed is that if the more the DNA damage, the more sleep that you need. And what they found is that in experiments, that if they cause more DNA damage, the sleep requirement would go up. And so perhaps the reason why we sleep is because that's how we repair any DNA damage that occurs during the day. And this was found a few years ago. This was done in shift workers, and what they found is whenever overnight on-site call participants, they had a lower baseline DNA repair gene expression, and there were more DNA breaks than those participants who were not working overnight. So first of all, night shift, working late at night, which you guys do, was bad for your DNA. The second thing was that if you were overnight and you were also sleep deprived, you had less sleep, then there was further decrease. And I want to tell you that these shift workers were on-call doctors. So this is something that we've known for a while. So I want to switch gears here and talk a little bit about why it matters to, say, your athletes. And I given the last two years that we've had, one of the things that clearly we now know is that poor sleep is a significant risk factor for developing injuries. So this is a year-long study. It was done in about 8,000 men and women in the Army Special Operation Forces. And they found that, musculoskeletal injury incidents had a dose-dependent relationship with the hours of sleep. So the more sleep you got, the less likely you were to get injured. And if you're getting 4 hours versus 8 hours of sleep, likelihood of your risk was more than double. So definitely there is that relationship. And if you remember, I've spoken about this in the past. This is a really nice study. It was done in adolescents. And adolescents are really easy to study. And what they found is these are, high school athletes, followed them for 22 months, found that anybody getting less than 8 hours of sleep, likelihood of getting injured increased 1.7 times. And another large study, again, prospective study done out of Europe in competition level athletes, found that you get, whenever there's an increase in training load and at the same time they're getting less sleep, the chances of getting injured really increases. And this is a great meta-analysis that came out. And it looked at all the studies that are out there, and they found that, that chronic lack of sleep in adolescent is associated with a greater risk of sports and musculoskeletal injuries, right? We don't really know right now how it's affecting it. We think we do. I mean, we know that if you get less sleep, your reaction time is impaired, you're more inaccurate, you're likely to put yourself in situations in which your risk-taking behaviors tend to increase. The other thing, this is done in NCAA athletes, and what they found is that, so they looked at preseason and they found that 28% had more reported high anxiety and 21% reported more depressive symptoms. And those who reported anxiety and depression were twice as likely to develop injury as the season progresses. So, it's a complicated picture. We don't really know what the answer all is. Now, this is another study. This was done in 190 Division I athletes. And what they did is that they found that, poor and inadequate sleep, so difficulty initiating or maintaining sleep, as well as excessive daytime sleepiness, significantly increased the risk for sports-related concussions. But this is a study that I really like, and it came out in 2020. Again, this is a Division I basketball team. They followed them for 2 seasons, and every day Every night, they asked them, how much they were sleeping, their mood, their stress levels. They asked them their training load. And they found that when they put that all into that equation, the only thing that was significantly predicting injury was the number of hours of sleep. So an extra hour of sleep reduced the likelihood of getting injured by 43%. And why is that important? Well, although there are no studies that look at how what the prevalence of poor sleep is in Major League Baseball players. We don't have those studies, but we do have them in NCAA players. And in the NCAA players, this just came out in 2019, more than 50% don't get enough sleep. These are athletes. And I could talk for at least an hour talking about all the things that, because there's a lot of research that's been done in these players. And surprise, surprise, they think sleep is their number one thing that they feel that their athletics prevents them from doing because of their schedules. So I want to switch gears here, and I really want to concentrate. I'm going to talk a little bit about what happens when you get less sleep, and I want to talk about the mental as well as the physical effects. And this affects athletes, but athletes are still young. They're young and healthy. It really affects you guys a lot. And that's what I want to draw your attention to. So first of all, this is Michael Perlis's phenomenal sleep researcher. And he says, it's bad to be awake when reason sleeps. And that is true, and that's what I'm going to show you, that being awake at night when you should be asleep is actually bad for you, especially for your mental health. And it's more so because of these two red areas. This is the amygdala. That is that part of the brain that's responsible for emotion. So, what do we know about mental health issues in athletes? Well, this is again NCAA athletes, elite athletes. This is that the presence of mental health problems is pretty high. Almost 1/5 report a high level of distress. Almost 1/4 report sleep disturbances. 1/3 report significant anxiety or depression, and 50% of the athletes report incidents. So sometimes during the year, they will have anxiety and depression symptoms. And 20% report alcohol abuse. Now, why is that? Why does that matter? It matters because sleep difficulty is associated with a lot of unhealthy behaviors. It's associated with drowsy driving. It's associated with driving while drunk. But it's also associated with increased substance use. So whenever there is either a current or a past history of poor sleep or sleep difficulties, well, guess what? People are using illicit substances more. So not surprisingly, there is this, deep bidirectional relationship that poor sleep and mental health has. In fact, you can't talk about mental health without giving sleep a seat at that table. So there are many storylines from here, and I want to go over at least two of these storylines. The first, of course, is that insomnia, which is difficulty initiating and maintaining sleep, is one of the most well-established risk factors for psychiatric disturbances, especially depression. And this study, there was that initial study which was done many years ago. So in the 1950s, they looked at medical school students, and they were not surprising, all men. And they asked them about poor sleep. And they found that those who reported insomnia or poor sleep were more likely to go on to develop depression and more likely to develop alcohol dependence as well as suicide. And this has been shown in multiple meta-analysis, right? So they've looked at multiple studies and they found that poor sleep is a risk factor for developing all sorts of psychiatric disturbances, including depression, anxiety, alcohol use, etc. And in fact, poor sleep is a risk factor for suicidal ideation, suicide attempts, and death by suicide. But here's the interesting thing which I want to share with you, that being awake at night itself is a risk factor for suicide. And I want to explore that a little bit more. But one of the things that happens when you work in Major League Baseball is that poor sleep becomes almost an integral part of what your life is all about. Well, why is this important? So here's a study, and it was done in collegiate athletes. So each additional night of insufficient sleep, not getting enough sleep, was associated with increased risk of suicidal ideation. Now, you remember how I talked about this story about that being awake itself is a risk factor for bad things to happen, suicide being one of them, homicide being another of them. So if you look at, so the way to look at this data is that these are the hours of wakefulness. You wake up around 6 o'clock, and this is a double plotted graph. So this is nighttime, and then people wake up again. And not surprisingly, the number of suicides are maximum while you're awake, right? You have to be awake to kill yourself. But look at this. This is when most people should be asleep. And these are the number of suicides. So these are people who've been awake. So when you do this regression analysis, the incidence risk ratio, so that they're going to be awake at night and kill themselves, is highest at that point. And again, this is not surprising. So this is a paper that came out in Science, which is a great journal, and they're looking at Twitter accounts. And there are different countries and different days of the week, and what they find is that between, say, 2 and 6 in the morning, there is a dip in the pleasant mood, and there's a rise in unpleasant emotional content when it comes to Twitter. And of course, we already know that there is a circadian phase to your mood. And when, between 2 and 6 in the morning, there is an increase in negative emotions, and there's a decrease, significant decrease in positive emotions. So there is this, again, this is done out of Michael Grander's lab, this midnight mind hypothesis, which there's something when you're awake in the middle of the night that makes things worse and makes people take more risks. And it could be multiple things that is happening together. So amygdala, which is responsible for your emotions, kind of lights up, and suddenly there is increased emotional driven motivation, attention. And then at the same time, there's also there's an increased anticipate. So there's the reward process to risky behavior increases. You have a tendency to ruminate more, and things that are responsible for good judgments, like your prefrontal cortex, that is responsible for good judgment, is decreased, is offline. There's diminished cognitive control, and there's diminished response to error and loss, all of which make being awake at night a significant risk factor. And in fact, this is a study done by Matthew Walker, and what they found is every night, while you're asleep, if you didn't sleep, your brain didn't hit that reset button and made you over anxious and less prepared for the day. So you're less prepared to cope with the stresses the next day brings. And if that happens, then you get more stressed out and you sleep poorly, and it's like a vicious cycle. And not surprisingly, so this is a study, this is a large meta-analysis, just came out this year. And what they found is that improving sleep health improved every aspect, all these different mental health issues. So improving your sleep, improved overall mental health, improved depression, improved anxiety, improved rumination, improved stress, and improved psychosis. Now, and the reason why this is important is that I'll be frank with you. I mean, I've come and given this talk or talked about sleep at least 3 times or 4 times at Major League Baseball. And typically I get a lot of phone calls or I get follow-up, and many of them are from the team behind the team. And they're asking about their own sleep issues and their own, all the things that they're struggling with. And what we do is we concentrate on the athlete, and we must concentrate on the athlete, but we must not forget that the team that is behind the team. Okay, so I want to switch gears, and I want to talk a little bit about the cardiometabolic risk factors that are associated with poor sleep. And this is, again, perhaps not as important as significant for athletes who are really young and healthy, although it would affect them long term, but it's definitely is a factor for the people in this audience. So this is a study, this is over the last 100 years, the number of hours of sleep that on an average people are getting in the Western world has significantly reduced from, more than between 8 to 9 hours to people are getting between 6 to 7 hours. And at the same time, there's a parallel trend in which the incidence of obesity, the prevalence is increasing. And so there's always this thought of whether this is related to each other. And this was found, this is a study which we did at the Henry Ford Hospital when I was still working there. This is Southeast population. So it's a population-based study, and found that anybody getting less than 6 hours of sleep, significant association of being obese, significantly obese. The 7 to 9 hours seem to be like the appropriate, the amount of sleep to keep you healthy. And this has been studied in experiments in which they've done experiments in which they've taken young, healthy adults, they've sleep deprived them, and found that just by sleep deprivation, their glucose effectiveness and clearance is significantly reduced to the diabetic range. And in fact, they've done this in multiple ways, and I just put up a couple of slides. So they suppressed only slow wave sleep and found that both glucose tolerance, just by 3 nights of slow wave sleep suppression, they were still giving them enough hours of sleep, but just suppressed their slow wave sleep, reduced the insulin sensitivity, reduced the glucose tolerance. In another study, they sleep deprived them and then allowed them to do something called ad lib feeding, which is that they're allowed to eat whatever they want to. And what they found is that if you're sleep deprived, they were having significantly more, consuming more calories. And these calories were high in fat and carbohydrate, not in proteins. So significantly, carbohydrate-rich food is what these subjects were eating. And one of the things that happens when you're sleep deprived is the hormone leptin, which is a satiety hormone that tells you you're full, gets secreted less. So you feel hungrier, while ghrelin, which is your stomach secretes to tell you that you're hungry, gets secreted more. So if you're sleep deprived, you're likely to be hungrier. So they've found that hunger and as well as global appetite significantly increases. And then of course, this group out of University of Chicago has done a lot of studies, all done in young, healthy adults. Mostly they take college students, but they've also done these studies in which they've given them the number of hours of sleep, like reduced the amount of hours of sleep, but they've also put irregularity in there. So what they've done is that they've done moderate as well as prolonged exposure to food, and they've put in circadian misalignment and found a marked increase in diabetic risk. And insulin sensitivity was reduced, and then even after this has happened, following 3 nights of extended recovery sleep, they still were having issues. So there wasn't complete recovery. And then again, this is study, I think it came out just 2 weeks ago. And what it shows is that what they did is that they were causing circadian disruption and in macrophages, which is the body's immune cells, and found that results in increased inflammation. And when you think about, how this may be a pathway to most of the disease processes that is happening, the cardiometabolic disease processes, because we talk about how increased inflammation is resulting in different disease processes. So before I go ahead, I just want to, I want to reiterate that whenever we think about the ways that people age and die, we think of the 3 main paths are either atherosclerosis, which is getting a heart attack or a stroke, or it's neoplastic, which is cancer, or it's neurodegenerative, which is dementia. Poor sleep and circadian misalignment contributes to all 3 of them. But then when you think of the unnatural ways that people age and die, do you think, car accidents, suicides, homicides, poor sleep contributes to them too. So with that, I want to make sure that I have enough time to answer questions. So I wanted to switch gears here and talk a little bit about how Major League Baseball, in fact, any athletic team should manage sleep in their during a season. And really, it really is a a complete process, and every step in the process is important. So you want to, there was a large consensus statement that came out in the British Journal of Sports Medicine, talking about how sleep should be managed in athletic departments, both at the collegiate levels as well as pro sports. And the steps are really, you want to give the entire team sleep education. You want to screen for sleep disorders, and you want to use athlete-specific screening tools that'll help you identify those athletes that may actually need to see a sleep doctor for a sleep disorder. And then you want to make sure that you refer that and you get those athletes treated. But then you also want to identify problems, any sleep problems that people may have. So not all athletes will have a sleep disorder, but they may not understand sleep. They may not realize how to fit it into life. And that's why you want to identify these sleep issues and then, re-educate. And I put this in because managing sleep during, especially for Major League Baseball, it really is a balancing act, and you want to get everything right. You want to get everything right because it's not just a simple matter of like wearing a device to make you sleep better. So in fact, there's studies that show that, less than 10% of athletes are typically wearing those devices at the end of the season. That's not what it takes, but really is a combination of, giving them education, screening them, and then, helping them manage their jet lag and giving them schedules, etc., so that they can fit sleep into their season. So with that, I want to end here. I'd like to acknowledge Dr. Michael Workings. He's the team physician in MLB who I first started working with. And then, of course, Kevin Rand is a friend and a good friend and a mentor. He was the head athletic trainer and now still at the Detroit Tigers. This is my information if people want to talk to me and ask me questions. I do have a few more slides about wearables, but I think I would rather be available to answer questions at this point. So I'm going to stop the share at this point and happy to answer questions.
Great job, Dr. Singh, once again. We have a question in the hopper, and it says, what is your opinion about the different kinds of wearables for sleep tracking? Apple Watch versus Aura versus Whoop versus Garmin. Any much better than the others? Any to avoid?
Okay, well, can you guys still see my slides?
Yes.
Okay, so I'm gonna, let me just talk a little bit about those, because that's why I put on those slides. I remember Nate had asked me to talk about that a little bit. So remember, sleep happens deep in your brain, right? And the way that for many, many years, we've measured sleep in the sleep lab is by putting, electrodes on your brain to measure the brain waves. But the brain waves are not what your sleep is, right? That's just the way that we as sleep scientists, we've come up with this way to study sleep. Now, in the last few years, there's been a lot of the wearable devices. Now, the wearable devices do measure two things. And the wearables you can wear, there are rings as well as things that you can wear on your wrist. So they're based on actigraphs, which we've had since the 1970s, which is, wearing a device that is a motion detector, because anytime you're moving, that means that you might not be asleep, and that's how we measure sleep. But in the last few years, what they've done is they've added more things to this. So for example, they've added heart rate variability. And now I'm definitely not an expert in heart rate variability, but I can explain to you what I know. And that's just something that we do. So if you think about the heart, there's an electrical system, there's the PQRST, there's this wave form, and you measure this interval between the two R waves. And if you think about heart rate variability, so this, typically there should be, this distance should be variable between the heart rate. And if you have a high heart HRV, it's significant for higher parasympathetic tone. And, it signifies a higher capacity for stress and better fitness. And if it's low, the sympathetic tone is higher, and there's low adaptability and sign of body stress. And so the newer wearables, what they do is that they have this heart rate variability that is also added to it that allows them to get a little bit more better usage of it. So I will not name one over the other. I think that there are a lot of validation studies, but validating them is really a process. It has to be done, if it can measure sleep as well as your the EEG does in a sleep lab, does it mean that it measures it the same way if it was if you were on a couch or in an airplane? I don't know if we know the answer to that. There's also a different problem with different skin types, and if you have tattoos or and so the good thing about these sleep consumer devices is it is easy to use, low cost. They are multi-sensory, which is better. They outperform the standard actigraphs. They have Bluetooth compatibility, but there are still limitations to validations. So I would say the limitations are really threefold. The first is that if you already have difficulty with sleeping, I don't think it's a good idea to wear this device. The second thing is that if you're having sorry, I kind of lost track there. So that's not a good thing. The second thing is that they're best if you're trying to look at trends. So if you're looking at the last 2 to 3 weeks and seeing, it'll give you data and it'll allow you to make some correlations. Well, on every Tuesday night, for some reason, I go to bed late, then I get less sleep. Then on the weekend, maybe perhaps I get more sleep. So you can use it for that. So that's one place that it could be useful. The second thing is that and the third thing is that, it's who does that data belong to? So you have to be careful about that.
Very good. One other question. Would you recommend blue light blocking glasses for our population?
Well, so that's an interesting question right there. Again, the story is it's really nuanced. That light from your electronic devices or any sort of light exposure in the evening will actively suppress your melatonin. Now, for some people, it's going to be quite a bit. So, there's again human variability. For some people, 10 lux is enough to reduce their melatonin by 50%. Others, up to 100 makes no difference. The blue light blockers are useful if if somebody is going to be on their phone a lot. The most recent studies really have shown that they don't really work. But because what you're doing on the computer, if what you're doing on the computer is interesting and it's interactive, then you're still going to continue to do it. So I would say that the best answer would be to talk to somebody and find out exactly why they need to use this.
And we have one more question, and this was related more towards the players. I know your talk is geared more towards the support staff, the team behind the team, but it has to do with concussions. Those athletes that have been concussed, catchers, backswings, foul tips into the mask, anything we should look for in regards to their sleep habits or encourage for those athletes that are concussed? That
is an excellent question. I really like that question because I'll tell you something. Being a sleep specialist, I really think concussion is a sleep disorder. So, there is, so far, for many years, the only thing that predicted a concussion was a prior history of a concussion, right? And so now that there's this study, of course, it needs to be replicated. It was done in the NCAA players that found that poor and inadequate sleep predicted a increased sports-related concussions. But if you think intuitively about it, it makes sense because all the reasons why poor sleep would result in increased injury, but also result in increased concussions. Now, because concussions happen deep in the brain, so typically it's axonal injury deep in the brain, and because sleep exists deep in the brain, there is sleep gets disrupted immediately after concussion. So if, especially in sports concussions, the first 2 or 3 days or even up to a week, players might sleep a lot, which is a good thing, because that's where recovery happens. But then subsequent to that, oftentimes sleep problems are the most difficult to treat. And the two main things that will happen is either they will develop insomnia or excessive daytime sleepiness, and they will develop circadian rhythm issues. So they'll have difficulty sleeping at night, will be excessively sleepy during the day. And often it might even be something as simple as prescribing a regular schedule, because typically when they're concussed, they're taken away from team activities, and so their schedule goes all haywire, and they start taking these long naps and they can't sleep at night. So within a week, instituting a schedule in which they are a little awake and active during the day, which helps them consolidate their sleep at night, is a good idea. There is some role for melatonin, and to be honest, this brings me back to that screening tools, because if one appropriately screened for sleep issues at the beginning of the season, then we had something to compare with when people do get concussed, when players do get concussed, to see if their sleep has changed, because we have this baseline data that we can compare with.
We had another question pop up here. Is it recommendable to provide melatonin to individuals early in the rehab process that struggle to sleep due to discomfort and pain?
You mean, is this after a concussion?
No, I think it's more just for an injury. Somebody that's not playing, they're on rehabilitation, they're having issues with the sleep schedule due to discomfort and pain. Is it okay? Is it recommendable to provide melatonin?
I think that there are two ways to answer this question. I think that if they're having sleep issues, they definitely should be evaluated by the team physician. So that at least, oftentimes it's just small things like, poor daytime activity levels, etc., that may be causing poor sleep. I mean, if they're having problems with sleeping because of pain, then the pain needs to be addressed. So that is the appropriate first step. But the second step is the next step is that there should be, all the teams should have a protocol in which what happens when athletes get injured, and how to address their sleep at that point should be addressed. And again, there has to be some screening tools so that you can identify which player requires the melatonin, and melatonin would be part of that protocol then.
Yeah, it was for an athlete that's post-surgical, so I think your answer was applicable. We have someone asking the possibilities to have access to the presentation. To have access to your presentation.
You mean my slides?
Yes, ma'am.
Okay, well, we can talk about that later.
Okay.
Right. Otherwise, I think that this is present. I mean, this is being recorded, right?
Yes.
Okay.
Yep. All right. I think that does it. Outstanding job once again, Dr. Singh. Thank you so much for your time.
Thank you. Can I say one more thing?
Of course.
First of all, thank you for inviting me, Nate. Thanks a lot. But I don't want to, I want to make sure that I underline the importance of good sleep for the team behind the team. And I've worked with Major League Baseball now for a few years, so I'm well aware of the schedule, and I think that it's important for the stakeholders to be aware of what the implications of long-term sleep disruption and circadian disruption does.
Thank you for caring about us.
Thank you for having me.
A lot of times we fall through the cracks. All right, outstanding job.